Hi, this is Greg. I'm here with Justin, and today we are going to provide you with a demonstration of the LifeLink virtual waiting room solution, which is a capability that is being utilized by a lot of health systems to deliver contactless intake experience for patients that are seeing their physicians. So, Justin, it's good to have you on the webinar, Chatbot Roadshow today. How are you?
Good. Let's jump in.
Yeah, so waiting rooms, we've all been there. We've all done this. It's a big deal. I mean, there's a lot of doctor appointments every year. 883 million times a year, people see their doctors. Hundreds of thousands of hours. But what's kind of shocking is a lot of people never see their doctor when they go to those appointments. 20% is a very high number, don't you think?
Yeah, you think about the times that you've been waiting in a waiting room 40, 50 minutes and you get frustrated or you have another meeting to go to after, and you just remember how frustrated or annoying that experience is.
Yeah, I mean, you go all the trouble to get there and then you never see them. I mean, what a bummer to rearrange your day. So, we're coming out of the COVID pandemic. Businesses are trying to reopen as we record this in mid 2020. And, as we've seen with retail and service industries, banks, travel industries, there's a lot of effort being done to change the way we shop or acquire a service because it really is about keeping people safe. And so, cones and stickers on floors are not a unique thing. But when you think of healthcare, it is a business. Historically, when you saw the doctor, you would go to a place, and that really has to change now as well. So, Justin, it's a challenge, right? There's a new normal that we talk a lot about, but it really is for patients. They need to rethink the whole way that they go see their doctors going forward.
Absolutely. There's no getting away that not all care can be virtual. Patients ultimately still have to come into a hospital or clinic setting for some type of care. Patients are delaying it right now because of safety concerns. And if you think about all the time that patients spend in a waiting room and all the care overhead it takes to help patients minimize their contact to non-essential workers, that can cost tens of millions of dollars in both lost revenue opportunity as well as additional administrative overhead if you're a large hospital system.
Right. There's obviously countless ways that businesses are trying to reset themselves to operate in this new normal. And, certainly stickers on floors and guards outside the gates, keeping people at bay is one way to do it. But really, the future here is technology. And I guess there's a perfect storm brewing because technology isn't about more apps or big portal logins that people haven't really used, that consumers have largely rejected in the past for healthcare. And we're at an inflection point because there is a new type of technology that's mobile and it's messaging, it's chatbots. And, we've seen a lot of very, very high engagement and satisfaction out of this new way of interacting with technology. And I think there's a big opportunity here to apply this to the waiting room experience.
Absolutely. I think if you are looking at ways to engage patients outside the four walls of the hospital in a reliable, sustainable way, mobile messaging is absolutely the place to reach them.
Right. So imagine here, this is a website of your provider. You've gone here, you've made your appointment, and now it's time to actually get ready to go to the appointment. And when you think of the virtual waiting room, it resembles the traditional waiting room experience, but it really encompasses more than just holding somebody out of the facility until their time is right. It's an end-to-end process that could span many days across multiple different workflows.
That's right. In a traditional waiting room, in a physical waiting room, you're there for the first 20 or 30 minutes before the visit. And there's a set of activities every patient has to complete, from being educated about what to expect in their visit, completing all the necessary intake and consent forms, and actually arriving and checking in with the front desk. What happens when you take that process virtual is now you're not constrained by the clinic setting, and the virtual waiting room spans all the time from the point of scheduling to when you are with a doctor in an exam room. And to pull off this whole range of activities is something that can be very challenging for a hospital system to pull off across several different scheduling teams and clinic teams.
Right, right. So our demonstration today will focus on the patient side, the operational side, and then we'll talk about a case study at Banner Health that deployed a solution like this. So Justin, let's start with what the patient sees and does as they lead up to this appointment. So you've got appointment prep, and there's some day of activities. There could be some adjustments in schedule. And then, of course, the TSA pre-example where people shoot right into the exam room. So why don't we start with the front of that chevron sequence and show how a patient begins to get ready for their appointment?
Great. The benefit of a virtual waiting room for patients is ultimately about flexibility. It extends that experience, which is 20 minutes before the appointment when you're on the doctor's time, to allowing all the time from the moment of scheduling to when you show up in the exam room for you to accomplish all the tasks that you might need to do, whether it's being educated about what your visit will entail or completing your intake forms or understanding what your arrival process will look like. So let's jump in. After your appointment is scheduled, you can imagine that I would get a text message like this. I would click this link to start interacting with the chatbot without any app downloads required. Because I want to have a conversation that includes PHI, because I'm going to be completing intake here, I'm going to authenticate using the first 3 letters of my last name and my year of birth, which I, like every other patient, understand. So the combination of those 2 pieces of information and the secure link in the text message allow me to now have an authenticated conversation with the hospital system. The chatbot will educate me about what this virtual arrival process looks like, so I don't inadvertently walk into the medical office building without being properly screened or being let in by the clinic staff. And you can imagine that currently this type of process is done over the phone with a patient and a clinic team member that are playing phone tag with each other. That becomes a very problematic process. And I can also complete the entire intake process through this chatbot on my own time, whether it's off hours or on the weekend, and to complete any necessary forms, medical treatment agreements, or consents that are needed. So I'm starting my insurance coordination intake here, inputting the information they'll need to be able to bill me. I'm putting in my insurance provider, and you can imagine that it's useful for the hospital system to have my insurance card on file. So I can also, through the chatbot, take a picture of it and upload it here. And if I don't finish this intake in one session, I can always come back and complete it anytime at my convenience before the visit.
Okay, cool. So now it's the day of your appointment. What happens there?
The morning of my appointment, I get a text message that includes an appointment reminder and asks me to confirm that I can still make it, which I can. And because we know that navigating to a hospital or a clinic or a medical office building can be quite complicated, I can also receive instructions about how to park or how to arrive at the facility. It's convenient here for me to see a map of exactly where I need to park, and I can save that information as well.
So one of the things that makes the waiting room experience not that great is often long waits, which is frequently because there was an emergency early in the day, the clinic is running behind, or maybe even early. Is there a way to use this technology to address that piece of the experience?
Absolutely. So imagine Dr. Singh's clinic is running late, as clinics often do later in the afternoons. And if the clinic knows it's running late, rather than having patients like me wait outside the facility for 30 minutes or an hour, I can proactively reach out and send a notification letting the patient know, in this case me, that Dr. Singh is running 30 minutes late. And here's what that might look like. You can imagine this is the same type of conversation that a front desk team member would have with me if I were waiting in a physical waiting room, letting me know that there's only one patient ahead of me or that the doctor's running 30 minutes late. And this solution allows us to automate that process to all the patients waiting outside the facility. Since I haven't actually left my house yet, I can now wait for another 30 minutes before showing up for my appointment. And imagine once I've arrived and I've safely parked at the garage, I can check in with the chatbot to let the clinic staff know that I've arrived at the facility and that I'm ready for Dr. Singh to see me. Once Dr. Singh is ready to see me, the clinic staff can send me a text message letting me know that I can come into the facility. And the chatbot can also provide me with a QR code or a badge to show to this greeter at the front door, letting them know that I'm cleared to enter the facility.
It's a little like TSA pre, isn't it? You know, you get your code, you put it on the red glass reader, and in you go. Let's flip it now and talk about the operational precision, efficiency that happens on the backside of it, which is, you know, the operators, the teams that are processing all of these patients on any given day. There's got to be an immense amount of efficiency and control gains that they're getting that will likely pay off beyond COVID.
Absolutely. The first benefit is that This type of technology can protect a care team and can enable better social distance because they're not managing many patients in a waiting room anymore. They're only ushering patients in for a couple seconds and move them into their exam rooms. The second benefit is eliminating any paper forms, which is predominantly the way that clinical intake is still performed. And it's not only patients that don't like filling out paper forms and touching physical clipboards and pens, it's the care teams that have to manage that intake process as well. So automating that process and reducing data re-entry and the cleaning of equipment and pens and clipboards in between patients can also have operational efficiencies for the care teams. And finally, being able to automate the entire arrival management process. That whole sequence of managing patients checking in, managing the doctor running late, understanding that a patient is running late and that they won't be able to come in until 15 minutes after their appointment, all of that manual work and phone tag that a care team is used to managing can now be fully automated by a solution like this.
Right. Yeah. There's a dimension here of when you talk about eliminating all that manual paper on data quality, just the digitization of poorly written scribbles has to have a lot of value in terms of insurance claims and things like that, right, Justin? I mean, in terms of just getting it right the first time electronically versus interpreting a 5 versus a 2.
Absolutely. If you look at just the time savings and operational efficiencies of what this looks like at a large hospital system, this can range in the $2 to $3 to $4 million just in offloading the work of intake and arrival management. But then all of the downstream impact, which is harder to quantify, but can be even a larger prize, the improvement in clinical quality by improving intake, the acceleration of your revenue cycle by collecting accurate insurance information from every patient. Those can ultimately dwarf this initial cost savings prize and can have a tremendous impact for any organization.
Right. Okay. Yeah. It's a very cool capability, and it's not just something we made up for this webinar. There is one of our customers, Banner Health, recently rolled this very solution out to across 300 clinics and 1,500 physicians. And so far, it's performing really well.
Absolutely. It's a win-win. We're seeing very high patient engagement, high patient satisfaction rates, while also starting to see some of those operational efficiencies for the care teams as well. And we're excited to see where this goes.
Yeah, and I think it's safe to say that while COVID is the reason this kind of implementation has been moved up in the priority list, it's a safe bet that it's going to continue on well past the days of this pandemic because the operational efficiency and value and patient experience is so much better. It will stay in place and become part of the new normal when seeing the doctor for years to come.
Absolutely.
Okay, Justin. Well, thanks so much for joining us today. And if you'd like to learn more about LifeLink, our demos, other capabilities, you can go to lifelink.com. There are other demonstration webinars available on our resource library on our website homepage. Thank you.
Hope you've enjoyed this episode of the Chatbot Roadshow. You can find other hospital, pharmaceutical, and research solution demos in our resource library at lifelink.com.